Hello everyone, I'm really happy that you are here today with me. So hello, my name is Sandra and I'm vocational skill tutor and assessor for student dental nurses. So alright, today I made a small presentation and this is the contest of the presentation. So my topic of today is your first week in the student dental nurse role, and here you can see some topics we will go through today. Okay, let's just dive in. So, hepatitis B. So, the first thing before you will be able to get your hands on assisting the dentist is to get your hepatitis B vaccine. So, once that is done, you will be able to start to train with hands-on experience. So, basically, it means without vaccination, the dental nurse runs the risk of becoming infected with hepatitis, which could then put the patient at risk. It is also a requirement for all staff who come into the counterfeit body fluid and blood during their work, or there is a risk from sharp injury or splashes such as handling cleaning and waste. So that leads us smoothly to go to our next topic, which is while you are waiting for your vaccination, you are you are still in training, but you haven't got your vaccine just yet. I think personally that the best thing you could do is take pictures of every treatment. This includes instruments and items needed for specific treatments. So, from my experience, I would say this works the best for visual learners as they will picture in their mind what they need to get out. Another good idea is to print out and laminate your tray set of pictures to be easily disinfected between patients and treatments. So this is how I did when back 5 years ago when I was a trainee, and it worked really well for me to be honest. And that leads us to if you are unsure about something, just ask. Um, I know that your mentor is there for you to support you, and if you don't have one, I'm sure the dentist or nurse will be happy to help you to get on your learning journey more smoothly. So don't be afraid to just ask someone for help, or if you are unsure about something, just ask. I'm really, really sure they'll be just happy to help you. So this is actually a big topic, feeling overwhelmed. And I mean, it's okay to feel overwhelmed. In fact, it's natural to feel overwhelmed. Talk with your mentor, head nurse, or practice manager about the way you feel and if you need more time, training, or support to gain more confidence. Because we are all just human beings, and even a experienced dental nurse feel overwhelmed time by time. And even myself, I still work in the practice and I do feel that way times, and I go to my practice manager and we just talk one to one. And then she sees what she can do to help me feel better because I said there is no same day in the dentistry. There is different patients, different things happening every day. So there is no two the same days. Okay, so working with patients face care can be hard work if you don't smile, but just remember, your smile could make someone's experience so much better, especially when you are empathetic towards the patient. Because a lot of them do have a anxiety coming into the surgery room, and they will remember you giving them that warm smile and just take that pressure away. And this is me. So yeah, as I already mentioned before, my name is Sandra, and I'm a qualified dental nurse with 5 years experience, and I am a qualified vocational skill tutor and assessor for student dental nurses. And it was my pleasure to present this presentation, and thank you very much. You're more welcome to ask many questions. And this is my part one from many more, hopefully to come. Take care and bye.